of 2024. Before we throw things back, let me take you back to a conversation I had with a very talented Ghanaian surgeon, and all you need to know about neck and head surgeries coming up right now. You're watching GTV Breakfast. My guest is a renowned surgeon and a professor of surgery at the Johns Hopkins School of Medicine. His name is Professor Kofi Owusu Boahene. You're welcome to GTV Breakfast.
Thank you. Thank you for having me this morning.
What's it like being a surgeon? Today we're going to be talking about head and neck surgeries, but just what's it like to be a surgeon and someone who teaches doctors to be great surgeons like you?
Yeah. There's something about surgeons. They like to fix stuff.
Okay.
And they like to see results right away.
Are you like the engineers of medicine?
So, sort of. You can think about that. We think about how things are broken and we want results right away. Whereas clinicians and medical doctors sometimes like to use medications and it takes time for you to see the results. Surgeons are impatient. They just like to take the tumor out or fix the broken bone or mend the cleft lip and see the results right away.
Did you always want to be a surgeon?
Actually, it's interesting because when I was growing up here in Accra, I couldn't stand the sight of blood. So I was the last person you would think would want to be a surgeon. But stories influence your life, people influence your life, and then you end up doing something that has become a passion of my life.
And you're very good at what you do.
Well, that's what people say.
They're telling the truth. When is it necessary for you to see somebody? When is it necessary for somebody to see you to take care of a problem?
So I work in the head and neck region. So anything from the clavicle up. Mm-hmm. So from the hair to the clavicle. Mm-hmm. And
where is the clavicle?
So the clavicle is the collarbone.
Okay.
That's the common name for it. It's called collarbone.
Okay.
So anything above it is my area of expertise. Yes. I do tissue transplant. So I may go to the leg and take a bone, but it always ends up in the face. Or I may go to the thigh and take a muscle and a nerve, but it always ends up in the face.
Okay.
So that's the area that's my canvas. Mm-hmm. People tend to see me for various reasons. I take care of all ages, children that are born a few days old to people in their 90s. A newborn may have what we call a congenital defect. They may be born without the muscles that allows them to express, smile, eat. And so for them, I would intervene early, transplanting muscles from the thigh to the face so they can move and smile and talk like everyone else. They may have a defect that is a cleft, a gap in the lip. People are familiar with that. And so you try to mend it. So that's somebody born with a problem. Other times it's an acquired problem. You are in a car accident, your face is mangled up, the bones are broken, we put them together. Or unfortunately you are afflicted with a cancer that eats up your tongue or your jaw or your eye. And so as a part of the treatment, you lose a portion of your face and your identity, and then we have to put things back together. And sometimes it has to be with a brain tumor that we have to find ways to get into the brain to take the tumor out. So those are the times that people tend to see a head and neck surgeon.
How common are head and neck issues?
Very, very common. And simple things, if you've had a cold and your nose is stuffy, that's a head and neck issue. It could be from allergies. It could be from what we call a septal deviation. The partition that divides your nose into left and right may be crooked, so you can't breathe on one side versus the other. If you snore a lot, it's a symptom that the back of your throat doesn't have a lot of space, so it just blocks up. So those are common things. So it's very common. Cancers and tumors, actually, one of the most common things we see in anybody who smokes. They tend to get lung cancer. They tend to get throat cancer. So it's very common.
And so I must imagine that if we are working with the head and neck, these are really delicate places where the slightest slip can cause more problems. What are some of the challenges with working on the head and neck area?
So the first challenge is that we are who we are based on our facial identity. So when you wake up in the morning and look yourself in the mirror, the picture you see is you. When you lose that, you lose yourself. So when I'm working on the face, I have to have that in mind. Versus if I'm going to take something on someone's back, you can cover it with the clothes. Your face, you can cover it. And number two, most of our sensories, the things that allows us to see, hear, smell, taste, are all compacted in the face. And it's obviously connected to your brain. And everything is in one tiny area, protected by bone, your skull, and tiny openings through which nerves move. So it is, if you've talked to anybody who's done medicine and gone through anatomy, that is the one area that they fear the most, because the anatomy is very delicate. So you have to know and work in precision.
What's it like looking into somebody's face through whatever instrument you have? What do you see there?
You know, the one area that actually is very, very scary is to see somebody's eyeball, right? Because you're looking into their soul, so to speak. But when you're doing surgery, you are so focused on a specific area, you lose sight of the entire face, right? You have it at the back of your mind, but you're just focused in a very, very small area. Now, more and more, surgery is becoming minimally invasive, and that's what we will talk about later with the approach we are bringing to Ghana and West Africa with the hospital that we are building. We don't do surgery with big cuts and opening the face broadly. We try to do surgery through natural openings in the face. So
what's a natural opening in the face?
So the nostril is a natural opening. It's a gateway to the brain. So a lot of the surgeries we do...
I can get to my brain through my nose.
You can get through your brain. Actually, the nerves of the nerves of the body are numbered 1 to 12. The first one is olfactory nerve. It's right and in your nose. That's what allows you to smell. So the inside the nose is a gateway to the brain. So we take brain tumors through the nose. The eye is actually a gateway to the brain. The eye socket is a natural opening. The nostril is a natural opening.
How about the ears?
The ear is a natural opening.
The mouth as well?
The mouth as well, yeah. So we do robotic surgeries through the mouth to go up to take tumors out, or you use cameras through the nose, use cameras through the ear, so that you don't have to disassemble the whole skull.
I'm interested in the robotic surgery. So you send a robot through my nose?
We can do the robot. The nose, the robots are too big for now, but we do robot surgery through the mouth.
Really?
Yeah.
How small are those robots?
They are not small. They are big, but they are huge. They have multiple freedoms of movement, but a fine endpoint user is like an extension of your fingers. Over time, we expect it to become smaller and smaller, and then we can do more with it.
Do you do brain surgeries too?
I do. So I do what we call a skull-based surgery. So the transition from the brain to under the brain, I do surgeries in that area. Yeah.
What does the brain look like?
I mean, you've seen pictures of the brain. It looks like this.
But I'm sure you see it quite close.
We see it quite close. Very soft, delicate tissue. You never want to see it broadly open. It's always pulsating.
It's moving.
It's moving. It's a sign of life. If it starts moving, there's trouble.
And are they the same sizes? I mean, for men and women?
No, actually, there are differences in sizes, but the components are all... if you take a baby's brain, the sizes are actually totally formed in childhood. The frontal lobe may change a little bit, but besides the size, almost all the components are there.
How long do just I don't know whether I can say an average surgery takes, but I mean, what's the shortest time you can take to fix a problem in the head and neck area, and what's the longest that you've actually had?
Yeah, no, it's very, very broad. Yeah, very broad. So a surgery could be last as 15 minutes if you are taking a skin cancer or a mole from someone's face.
15 minutes?
15 minutes.
The person will be asleep?
No, you just...
The person will be awake?
Awake and numb the area you do it.
Okay.
And I've done surgeries that are as long as 32 hours.
32 hours?
Yes, and usually it's not one person, multiple people working in different components to try to get things done.
And the person is under anesthesia for that long?
Yeah.
32 hours?
See, it's not a duration of anesthesia if you have a good team. That is a problem with surgery. It's the takeoff and landing. So putting someone to sleep and waking them up. Those are the two dangerous areas of surgery. But during the mid portion of the surgery, it's a very smooth sailing thing.
I must imagine that there's a lot of concentration when you're working on long surgeries, even short ones, because the head and neck area is a delicate area.
Yeah. A lot of concentration. I work under a microscope a lot. So you bring the microscope and it zooms things out so you can see it magnified. Or I work from a screen with a camera, and sometimes it's in 3D, so you can really see it. Yeah, you can't blink.
Is it true that your hands have to be steady?
Your hands have to be steady.
Okay.
Yeah.
And what are the other attributes of a good surgeon?
Actually, a good surgeon is not necessarily the technical portion, it's the human portion. So it's easy to cut things and close it if you know how to do it. But you have to connect with people. I will not go to a surgeon who cannot speak to me and understand my family background, the things, social settings, the things that are going to support me when I'm healing after surgery. So to me, what distinguishes a good surgeon from an average surgeon is the one who really connects with you before they even bring the scalpel the first time.
What are some of the common challenges faced with people who have to do neck and head surgeries in Ghana?
In Ghana. It's a very specialized area. So head and neck surgery in the U.S., where I practice, is an extension of something we call ear, nose, and throat. So I'm an ear, nose, and throat surgeon as well. And the extent of what we do in the U.S. is very, very broad and highly specialized. In Ghana, what I've seen, and I've been doing work here on a pro bono basis since 2004, that we have good doctors, but the level of sophisticated specialized care, we hit a cap. And because we don't have the institutions and the infrastructure to train people to that level, and those who want to train in that level, when they go, they are at the prime of their lives and they don't come back. So that's one of the issues we are trying to solve with the hospital we've just built.
And so, talking about that hospital, so the acronym is WAISS.
WAISS.
What does it stand for?
So WAISS stands for West Africa Institute for Special Surgery. Because we want to provide the highly specialized surgery that people have to go and seek care elsewhere. They travel India, South Africa, the US, UK, Germany. We have the skill, and a lot of us are actually Africans, Ghanaians, and we want to concentrate that skill and bring that skill set here and be able to pass on that expertise to the growing next generation of surgeons.
So what kind of neck and head and neck problems can be rectified at WAISS?
Anything you can think of, from restoring people's hearing, fixing people's ability to move their face when they have stroke, taking cancers out, fixing leaks from the brain, and taking tumors out. So anything that you can think of, that expertise is covered.
And do you do like a plastic surgery as well?
I do plastic surgery.
So who are the common clients who come who want to have something done to their face? Is it more men or women?
Both.
Really?
You'd be surprised.
Okay.
Yeah, so if you have someone who is prematurely balding and they want full hair back, that's plastic surgery.
You can restore the hairline.
We can do that. We can transplant hair back.
Where do you get the hair from?
So usually there's a pattern of balding. Mm-hmm. You see the front hairline recedes,
yes,
and then the central hair balding,
yes,
but the back hair tends to be full.
The back?
Yes.
Okay.
So we do what we call follicular transplant. You go and pick the hair roots and you can transplant it.
And you add fertilizer. I mean, how do you do it?
We have fertilizer. So there's a way to make openings, and then it's almost like planting a tree, really.
Really?
You have to uproot the root, what is called the follicle, and then make an opening and put it in. And we have medications that that enhances the growth of
And how long does it take from almost motorway to full hair?
Over a 6 month period, we can have a full.
So the guy goes in with a receding hairline, and then in 6 months, full head.
Full head.
Wow, it's like magic.
Yeah. So for males, that's the common thing.
They want to keep their hair.
They want to keep.
Well, why are men so attached to their hair?
You tell me.
Yeah. And then the women, what's the common one?
Women for the face.
Yes,
it's very broad. I'm known for fixing noses to make them look more congruent with the rest of their features.
Okay, they want pointed noses.
Not pointed, I wouldn't do that. Yeah.
So, what kind of nose do they want?
So maybe someone will say, my nose is out of place. I got my dad's nose.
Okay.
Right, and
I want my mother's one.
I want my mother's one.
Okay.
Right, or I think it's out of proportion.
Okay.
So we can change it.
All right.
People aging, one of the areas we age the most is around our eye. We start getting bags around your eye. It makes it look like you are tired, but you're not tired.
Okay.
We can do that. And some people, you end up getting...
It's a double chin.
Double chin.
So you can take away the double.
Yeah.
Make it single.
Yes.
You guys are magicians.
Yeah, so we can do that.
Yes.
Yeah.
Is there anything else you want to say about head and neck surgeries?
Head and neck surgery. So at WAISS, it's not only head and neck surgeon. I tend to be a head and neck surgeon. My younger brother is a head and neck surgeon. But I have partners working with us.
So you have two surgeons in the family?
We have two surgeons, anesthesiologists, and we're just a family of...
Yeah, just like medicine?
Yes.
Well, it works.
I'm the oldest, so I think I just drank them.
Yeah, I think they got inspired by you. Yeah.
So we are covering other specialties at that place. But head and neck is my specialty, so I can talk more about it.
Okay.
But in general, I think we've covered it.
All right. And it's at Ofankor, I believe?
No, it's Oyarifa region.
Yeah. Okay. Hey, Prof, it's a real pleasure speaking to you, and we wish you the very best with WAISS, and may people get to benefit a lot from getting fixes to their neck and face and head areas from your wonderful team.
Wonderful. And we cover urology. It's a big problem.
Yes.
Yes, so one of our urologists takes care of all the urologic problems. So we want to offer our expertise to the country and the region.
It's a real pleasure.
Same here.
All the very best.
Thank you.
You're watching GTV Breakfast, and thanks to Professor Boahene for a fascinating dive into the world of head and neck surgery. Stick around. We'll be right back.